We're excited to have some of my favorite people in the world, our students on both sides of the ocean. So we have our Slemenda Scholars, who are rising second year students from Indiana University who spent their summer in Eldoret. And I would like to introduce Marissa and Michaela.
Hi, everyone. So great to be with you all here tonight. Thank you, Jenny.
Perfect. And then we have our Einterz Scholars from Moi University. They're currently here in Indianapolis doing their rotation. Moi students have been coming to IU since 1995 as a part of an exchange started by Dr. Bob Einterz. And the Einterz Global Health Education Fund was established in honor of Bob and his wife, Leanne, to contribute to the vision of providing training care providers in Kenya and beyond. And we're really, really happy to have this first cohort of Einterz Scholars with us today. So I'd like to introduce Wendy, Aisha, Kevin, and Tony. Over 32 years, AMPATH has trained more than 2,200 Kenyan and North American physicians, and we're really excited to see some of those on the call today. So this fireside chat was designed as a conversation between the students. I don't know about you, but some of my favorite thing is to see students talking to each other and learning from each other and growing together, even kind of without me there in some way. So we've designed this to be sort of just as a conversation between them. And then we'll have a chance to ask them questions at the end. So without further ado, I will turn it over to the students.
Hi, everyone.
Hi, Wendy.
Okay. So the first question goes to Marissa. How did you find your experience in Kenya last summer?
Thanks, Wendy. Good to see you again. We all got to meet each other briefly at sort of like a welcome meal, a picnic, when all four of you got back from Kenya, and we're excited. I think a lot of the Slemenda Scholars and Einterz Scholars are getting together this weekend too. So I'm excited to see you all again soon in person. This summer in Eldoret was like truly transformative. I didn't have a lot of expectations going in of what the bilateral partnership between Moi and IU was going to be like, and I was like surprised and pleased in every way. Some things that surprised me the most in general, I guess, about Kenya were some of the AMPATH existing outreach programs where we would go out with Keisha groups or microfinance groups or mother-child groups and sort of go into a space where trust and a tradition had already been established in the community, something that like women and their children were already doing, or that friends and neighbors were already doing, going into an existing model and working to build on that and overlay healthcare. That was surprising to me because it seems super intuitive that we just bring healthcare and resources to a place where the community is already meeting and there is great need. But I've never seen anything like that really being implemented in the United States. So that was surprising in a great way. I also thought it was super surprising after rounds finished on like both the adult medicine and the pediatric wards that many of the patients who had the mobility to would go outside and enjoy the sun and like open space and air. And I think that should definitely be translated back to the US, because if you all have experienced in your last few weeks here, I think it's a really sterile environment on wards in the United States. So those were some things that surprised me. Also, like the English, Swahili, and mother tongue mix in the same sentence. That's always surprising, trying to follow along. I don't know if you have any thoughts to add to that before I've got a question for all of you. Wendy and
you
Kevin.
can go ahead. Thank you for that answer. You can ask us.
Okay, so I guess we can start with you, Wendy, and then Aisha, and then we can go to the boys. How have your rotations been so far at IU, and what have you found novel or different from rotations at home?
Okay, so it's been amazing, and good to appreciate the different practices of medicine, as in the technology, the EPIC system, it's as in the results and the lab results, the imaging just at the touch of a button. It's awesome. And also the turnaround time for the lab results, imaging results, it's so short. Like just in a you just get your results in a short time span. Yeah, maybe someone else can also share what is seen different than home.
So hello everyone, I'm Kevin. So for me, the rotation here has been amazing. I've learned a lot of new things. So I feel like I've gained more compared to before I came here. But for me, the main thing that is so different from home is the number of hours that the consultants work. It's surprising that they come at 7 a.m. By 7 a.m. they're in the hospital. Some leave at 8 p.m. on call days. So it's wonderful. And you have a consultant on call. So any question you have, he or she is there to answer them. And I think that's different from our system in Kenya. Yeah, and then another thing is the friendliness of the health personnel here and the staff, and how the doctor-patient interaction, it's more of you're on the same page, not like the doctor is in a higher form of authority, commanding the patient to do this and that, but it's more like an interactive session where the patient has concerns, it's being raised. I feel it's more, the patient feels he or she is being heard more, and the doctor is more aware of his or her problem. Yeah.
Tanya or Wendy? Or
Anthony, we
Tony,
can't hear you. Please unmute yourself.
Oh, sorry. My name is Anthony, and I had a question for Slemenda. I had a question for Michaela. My question was, how's your experience in Kenya changed the way you think about healthcare? Because obviously healthcare there and here it's different. What has it changed about your perception of healthcare?
That's a great question. I feel like there was a lot of preconceptions I had about healthcare. So the Slemenda Scholars didn't really have a clinical focus to our program. We were mostly working on research projects. So research projects were kind of the base of our experience there. And I think with the AMPATH programs that we saw, I noticed, kind of like Marissa was alluding to, how there are just many ways to deliver healthcare rather than just the clinical setting. We saw a lot of community-based programs. The Traumas for Change, like Marissa was talking about, the Big Pick in Webuye, we saw providers going out to communities, doing healthcare, educating about diabetes, how to care for your child, all of those things. And also Marissa and I got to participate in kind of this healthcare education during we worked with Child Life at Moi, and we gave education or parent education talks where we asked the parents what they wanted to know about their child's health, and we kind of answered questions. And I think with the cultural nuances, some ways of delivering healthcare work better than others. And I think I got to see a lot of that in Kenya. Do you guys have anything to add to that?
Thank you.
I have another question for you guys. How do you feel like you will be a better doctor because of your time in Indiana?
So for me, I feel like my time here has helped me now get to see medicine as an art and a science at the same time. So what I mean is that it's helped me see it as in an interactive session between a patient and a doctor, where a patient gets to express their needs, their concerns, their questions without any fear of judgment. And I've gotten to see how the doctor, on the other hand, is supposed to interact with a patient to get all the information that's relevant in their management. So a doctor is supposed to exercise kindness and empathy and concern. So that has been really interesting to observe. And when it comes to the science part, there's a lot that I've seen here in terms of technology, getting to combine the different results from the labs and using all that to come up with differentials and a plan for management and treatment modalities. So it's been eye-opening to see how to combine the art of medicine and the science together to become a better doctor in the process.
I think I can also answer that. With regards to how my stay in Indiana will be able to, has helped me for the better. I think since I've come to Indiana, I've had a broader perspective of medicine. I have come to understand the differences between the medicine in Kenya and the medicine here, and how there is sort of a huge gap between what is here and what is there back home. And it has made me realize that there is so much room for improvement back home, because we should be able to, at some point in time, attain these levels that we see here. Basically, from the first few weeks, I just started realizing that we have so many problems in Kenya that we should try to solve. And I think coming here helped me understand just how big the difference is, and sort of how big that problem is. And I think it has sort of inspired me. I think as this generation, this young generation who've come here and have understood and seen the difference, I think when we go back and we try to approach problems, I think we'll try to approach programs from a broader perspective, with the knowledge that it is possible to achieve better delivery of healthcare, just as it is possible here. I think basically that, yeah.
Okay, I have a question for the Slemendas. What's one of your favorite memories from your trip to Kenya?
Thanks, Aisha. I also liked hearing what you guys have learned from your rotations here so far, and especially Anthony, that you're coming away from it inspired, because I feel like I also came away inspired, like being in Kenya and seeing both things that I want to emulate in my work here and abroad, as well as things that I hope can change all over the world. And it's fun to be surrounded by people who the reaction is excitement and not despair or hopelessness. I think that like everyone on this call is probably in that party of hopefully you see things and you're excited to change them. This summer, my favorite, like sort of like a bucket of my favorite memories are spending time with my fellow Slemendas, Michaela, and then our friend Destiny, who's running another thing because busy lady. But Destiny, Michaela, and I made great friends with some of our similarly aged colleagues on our AMPATH research team. So my close friends, Faith and Jillian from the AMPATH SIMS mental health team, and then our friend Mercy on Michaela's team in the neurodevelopmental research team. The 6 of us or the 5 of us, whoever could hang out, we spent a lot of time together after work. We loved going to get ice cream and milkshakes, and we went to this youth drop-in center in downtown Eldoret called Family Health Options Kenya, where they have a lot of dance classes. And our friend Mercy is a pro salsa dancer. The rest of us looked like we had 2 left feet, but we went all the time with her and learned from it was like free instructor-led classes, which was super fun. And it was a great way for us to also get to meet other like Kenyan 20-year-olds and teenagers and see what's fun on the weekend. And like our biggest adventure that we had, all 6 of us, was going hiking at Umbrella Falls, the waterfall, which is just inside like Eldoret town, like limits. And we did that on a very muddy, slippery day. And our friends from work were hiking in like beautiful outfits, and luckily no one went sliding on the waterfall. But yeah, we miss Faith, Jillian, and Mercy a lot, but our group meet, like our WhatsApp, is still ongoing. So we're staying in touch and excited to get to be together again, hopefully in another rotation in the future. Michaela, do you want to slide in with a favorite memory, or shall we go to our next question?
Oh, you stole all of my favorite memories, but I guess that's a good thing that all the memories that we share were good. But I would have to say one of my favorite things. So Marissa worked with the Husisha team, and I worked with Dr. Megan McHenry with the neurodevelopmental team. But just having chai, I think, during kind of those hours before lunch and like after breakfast, I think was one of like my most favorite memories, because I think I learned a lot from my Kenyan counterparts during those times. And I also realized that I really, really like tea. And I have definitely made more tea coming back to the US than coffee, which used to be my drink of choice. How I guess to the Kenyan medical students, do you guys find yourself drinking tea or coffee here more often?
So I think right now it's coffee. The tea here, it's one of the few times we have coffee, we have tea, but majority of the time we drink coffee. Although it's too strong, the American coffee is so strong. Like I'm not used to that strength of coffee.
Yeah, it's too much. It makes you shake. I prefer mixed tea if possible. Mixed tea is just not like pervasive. You can't get that anywhere in the hospital. I have a few questions for all, Wendy, Kevin, Anthony, Aisha. What has been one of your favorite things about Indiana or you've done in Indiana so far?
So for me, last like this Monday, I think during the Labor Day, we went to Bloomington. I like the environment there. It's forested, quiet, and it's like a pristine environment. It's such a huge contrast from where we are here in the city, where there's a lot of noise pollution. Yeah. Another thing, the buildings in Bloomington. Wow, nice.
I am on the Bloomington Med campus.
Yeah. So yeah, and the buildings in Bloomington campus, they're so beautiful. It's not like just a standard building where it's just a tall box. It's like it has a weird design. This represents this. Went to saw the new IU Health Hospital that was launched last year, I think. It's such a nice hospital. The golf course closer to behind the hospital. Then we went downtown where we saw the various restaurants there. Yeah, it's such a, people say it's a small town. I'm like, wow, it's a huge town with like 50,000 college students. It's such a huge town. Yeah. Another thing, after that, we went for dinner with the Bosins. It was a nice dinner. The food was wonderful. Then we went to Lake Monroe. At least, yeah, it's the lake is clean. That's the first thing in contrast. It's undisturbed. Water is clean. The boats are in good condition. We went swimming. I don't know how to swim, but at least with the life jacket, I could swim. Knew how to float from that trip. So at least it's a nice step towards knowing how to swim. Yeah, yeah. So that's it for the Bloomington part. The other thing is we went for a baseball match with I think one of the previous Lemandas. It was nice. And at first, I didn't know the rules. I'm like, why are they doing this? Are they doing that? But at least for the first time, I was like, okay. At least now it's making a little bit of sense compared to when I'm back home seeing baseball. I'm like, okay, it's a weird form of cricket. At least now it makes sense to me. Yeah. Then also here, yeah, I feel like the city has very nice views. We went to I don't know, people call it the square, I think, where there's an old Coca-Cola company. We went also for a movie theater there. Yeah, we watched a movie. It's quiet. Yeah, we took so many photos. We went to the gardens. I like how the how the city has a lot of green spaces. It's like it's nice urban planning. Yeah, I think that's it for me. Maybe the others might add extra.
So for me, I like the state fair. So for the previous group, so I sent them pictures and they're like, you're so lucky, like they didn't get to have the state fair because it's they have a specific timing for it. So I'm glad we got to see it, the different kinds of food, different games. It was wonderful. Also another thing, the American football. It was amazing. Okay, I'm not a fan of games and footballs, but Debbie gave us very good classes, and okay, she taught us about the American football before the game, and it was awesome. I really enjoyed the game. I must say that I'm not a fan of games, but I really enjoyed the American football game, and I'm glad I got to learn how it's played because I have never watched one before. Yeah. And also the people here, the people are so kind and generous, and that's so beautiful. Yeah, anyone maybe who can that's a few of my list because it's endless. Everything here is so good. Yeah.
So fun to hear about all your favorite things. Were you were at the IU football game this past Friday?
No, we were not there. We were not there.
Okay, earlier football game. That's so wonderful. The state fair is a special experience. I'm glad you got to go there. It's so fun, and I loved hearing everyone's reviews of everything in Indiana. I was born and raised in Indiana, and Michaela has lived in Indiana for a long time, so it's fun to hear like the fun things about Indiana through new eyes. And I am sitting in the new IU Health Hospital. I'm in the half that it's the academic center, so we have our classes on one side, and then there's a wall that takes us to the cafeteria and then into the hospital. So when I go like on clinical rotations, I'll go walk on the other side. But it's a really nice hospital. I enjoy it. And when I didn't want to interrupt you, I think you maybe had something to say.
Oh yeah, I just wanted to add and say that I really enjoyed the cheese. I love cheese, and in Kenya, cheese is so expensive, but here it's readily available. So that's been amazing for me.
So I always tell Wendy she's been born in she wasn't supposed to be born in Kenya. She was born in the wrong country because she loves cheese.
What cheese do you like, Wendy?
I don't think I have any specific cheese that I like over the other because I've been trying out new cheese, cheddar, black something, black. I'm not sure which one it was. I tried it today in my sandwich and I really liked it. And when we went for the cookout, there were so many dishes made with cheese. And the cold salads, I tried the potato salad, what other salad? I don't remember, but I really enjoyed that, the food.
That's really good because Marissa and I also really enjoyed the food in Kenya. I would think that we tried actually this past 2 weeks ago to make Kenyan food. I go to the Terre Haute campus at IU, and I invited all of my classmates over for dinner, and I made them chapati and skuma wiki. And Marissa, what did you make them?
We made when we tried to make nyama choma, we didn't have like a huge roaster. We were on this tiny electric grill, so it didn't go that well. And then we also made like sort of like najahe, like the black beans and red peppers and coconut milk sauce. And what else? Was that all we made? Yeah, that was, yeah. We did chapati, skuma wiki, black beans, and nyama choma. It was good. It was really fun. I'm trying to see if I can send a picture of some of the stuff, but I don't know if the Zoom chat lets you put pictures in it. I don't think it does.
It was an international themed dinner that we had. So, and they really, my classmates enjoyed the Kenyan food as well. They especially liked the chapati, I think. And I know that I specifically love, I've had chapati before Kenya, but I feel like chapati in Kenya is just different. Are there, besides cheese, are there any other foods that you guys enjoyed so far?
I got to test elephant ears from the state fair. They were good. Yeah, I've never seen elephant ears. Yeah.
I love a good elephant ear. So yummy. It's kind of like our mandazi, a little.
Yeah, I think also there was some donuts. The one that has, I think it's only sugar, but it's so sweet. And it's un-American because here you find here the majority people it's so sweet. People here care about, I don't know, sugar, calorie intake, and that thing is a contrast to that here. I think Dr. Benzenga bought it for us one time, and I really enjoyed that. I think they were donuts, but I don't know the specific name actually, but yeah.
Sounds like a funnel cake, maybe.
I think it's that one.
You didn't make donuts, Kevin?
Yes, the donuts. Yeah, I don't know their specific name.
For me, with regards to maybe what I have found interesting or fun with regards to food here. When I came here, I had plans to try out most of the things that I've heard of, but haven't really had. Because in Kenya, we know about McDonald's, we know about Subway, we know about Chipotle, Panda Express, Chick-fil-A, we know about them, but we don't really have branches of those franchises in Kenya. So personally, I made it a personal experience to try as much as possible. I've loved most of what I've tried out. I'm still trying out. I still have time to cover as many as possible. But one thing that I've found to be a bit different and much better, obviously, is maybe it be because of the cheese, but I've really loved the pizza in America. Pizza in America is good everywhere. You can just walk into any place, there's pizza. It will be better pizza than pizza in Kenya. Probably it's because of the cheese, as Wendy said, which is available here. But yeah, but we've also tried other kinds of food. We've tried Mexican food. We've tried Chinese food. We've tried Middle Eastern food. Many of these options may not be available in Kenya. And it has been exciting for me to try out most of these things. Yeah.
Before we move on from the food, something interesting that I found was in Ashkenazi, when they offer to give us lunch. In Kenya, I expect to have hot food, like maybe chapati, beef stew, and rice or something like that. But here, they'll give us, there's a day they give us a sandwich and some potato crisps. and that's different from home. It's been interesting to see that kind of difference. Oh, plus also the fact that Eskenazi actually serves lunch from time to time. That's been good. We look forward to the lunch days.
That's so funny. That is so true that when a US workplace says they're catering lunch, it's never hot food. I sat in Nowhere Center. I don't know if have you guys been in Nowhere? They built it like way back in the back, like past the old Rafiki Center, past the sanitation. It's like near the back of the Moi campus. I don't know. It's a new building, but it is an inpatient step-up center from after the psychiatric ward when people leave, but they're not quite ready to go home yet. And so it's beautiful. It's like a big home, and they also have gardens, like a little farm, and like big open spaces where they go like do outdoor activities and skills development and stuff like that. But one of the skills development was preparing people to go back and like run their family homes. And so they taught them to make food. And so then we always got their daily craft of whatever they're practicing making, like stew or beans or cabbage, skumawiki. And my colleagues were always like critical. They're like, oh no, there must be a new client cooking today. Like there's huge chunks of ginger that's not actually cut up. But I found it to be delicious and definitely a cut above Eskenazi catering.
Okay,
Jenny, do you have a question?
Yeah, let me ask you guys a question. I think you guys you may feel like you have a significant difference between you guys because Marissa and Michaela, you guys are in your second year of medical school. Kenyans, you are old experts. You're fifth year students. You've learned so much medicine, but to me, you're all students. So you are all the future of medicine. And I guess I would just ask, like, you've seen a little bit of the Kenyan medical system, you've seen a bit of the US system. What do you want to keep out of both? If we were going to design a new system that was going to work better, or in what ways, what would you keep out of each system? So, and particularly Marissa and Michaela, like, what did you see in the Kenyan system that we should keep, that we should come back and bring, and vice versa to you Kenyans? And it can be short answers too, if that's needed.
Sure. I'll start because I want to explain. I just sent in the chat. I was trying to figure out a way to send the picture of the Kenyan food Michaela and I tried to make, so I just sent a link to a Google document. Hello. And so I think two things I definitely would love to emulate from what I've seen in the Kenyan medical system. Number one, sort of the structure of family and home and community as the first level of intervention, and then dispensaries, and then sub-county hospitals, county hospitals, and then referral, like tertiary referral centers like Moi. I feel like in the United States that stepped care approach is not as emphasized. Definitely there's a movement towards preventative care in medicine and primary care, but I think something more like dispensary or community health volunteers having more accessible access at that level so that people would feel greater comfort in the medical system and also not feel like they're driven only to use the emergency department because they don't have a routine like point of care access. I think that community health volunteers or other health professionals like nurses or like how the clinical officers go out and staff some of those places. I think in the US, we're underutilizing certain types of care providers and not putting in enough access at different levels, I think. And then that's why our emergency department, which is something I love about the ER, becomes sort of like a front door and a primary, like a home for primary care for people who don't have access. So I think delving into more resources of steps care would be good in the US, as well as I didn't notice, like when I was on rounds, which as Michaela said, our focus this summer was a research summer, so I didn't get to see a lot of daily rounds, but I saw many of the units once or twice. And I felt like it was such objective presentation of patients and like good factual presentation of the present illness without any sort of bias or judge, which often in my experience, I've worked in the ER for many years, and like doctors and health professionals presenting on their patients will like add a little bit of personal commentary on like, you know, what parts of the story they don't think are real, or, you know, use certain biases about maybe like familiar faces in the emergency department, like people who keep coming back for the same thing, that sort of stuff. I felt presentations were really objective and compassionate, and also like address social determinants of health often, like really considering aspects of like financial concerns for like non-adherence to prescriptions and malnutrition as possibly like contributing to some pathology that may not seem directly related. I just thought it was really like holistic presentation, and perhaps more understanding than some of our providers, like, and more understanding than maybe I am in certain situations. And so it reminds me like to check myself as well.
I agree with a lot of what Marissa said. I think I would just want to kind of reiterate the community level care. I even also think that what I saw a lot specifically at Moi was like peer health educators. So specifically on the project I worked at, I was in the maternal child health clinic at Moi, and there were mentor mothers who were helping explain health topics to mothers who have HIV, who are HIV infected. And I feel like in the US, there is less so much of like the peer-to-peer communication. I know Marissa's project also like utilized peer mentors. And so those are, I feel like, strengths in the Kenyan medical system, the sense of like, you're not in your healthcare alone, that there are other people there to help you. But I also find it really interesting that Marissa brought up the objective like presentation. I think I definitely saw that in the internal med wards. I think there's a sense of resourcefulness in like that I saw in the internal med wards, because like I guess there are very stark differences in the technologies available in like the Eskenazi wards versus at Moi's. Not everyone's hooked up to an EKG, and you can't tell, you're not like constantly monitoring them the same way. So I think that is also a strength.
Yeah,
Okay.
for us, thank you, Michaela. But for us, what I feel like here in the US is, yeah, I like how you have consultants in everything. Like you can diagnose, let's say somebody has this particular disease, maybe it falls under maybe infectious disease. You say, oh, let's do a consult with an infectious disease team. You know, in Kenya, like if you're a surgeon, you must know how to treat surgical site infections effectively. If there's resistance, you must know how to do it. And then there's so much specialization. Like I was surprised there's a podiatrist. I was like, okay, I've never had. I had to Google who is a podiatrist first. Oh, it's the foot doctor. I'm like, oh, okay, that's an interesting specialization. Yeah, like here people were saying, oh, amputation is done by the vascular team. Amputation is done by the orthopedics team. As you know, amputation is orthopedic team, and maybe if you're in a more county hospitals, you might find that even if you're a general surgeon, sometimes you might be forced to do an amputation because you might be the only doctor there. Then the other thing that I liked here is obviously the patient to staff ratio. Like have like in the like you have a nurse, let's say in the ICU setting, each nurse has 2 patients. Then in the maybe let's say the high acuity wards, every nurse has like 4 to 5 patients. And I think it's nice. Although here say I'm seeing relatives don't help the healthcare workers in terms of managing their patients, like bathing them. But here, in Kenya, you find 4 nurses managing a farm with like 60 patients, and it strains them, and then it makes them not enjoy their work more. I feel here the healthcare personnel to patient ratio is so nice. And then like another thing here is that I admire about the system here is like the cap limits. Like every intern has 5 patients at tops. I was like, okay, because in our back in Kenya, an internship is a very demanding year. Actually, I think you manage so many patients. You might find you have a whole ward with 60 patients. You are the intern there. You must pre-round all your patients before, know everything about them. Yeah. And the other thing I loved also about the US medical system is that if you want to be a physician, you just do this. You begin from your internship. You do medical year. Just that is from your internship. People specialize early. Like if you want to be now a hospitalist, you are from your, you don't have during your internship, you don't have to do psychiatry, you don't have to do obstetrics and gynecology, you don't have to do surgery, because in Kenya your internship here is you do all those 5 main areas of clinical specialization. Yeah, and the other thing that I love about here is that if you're a resident, you're paid. And I don't know if they pay school fees, so I won't comment on that, but it's at least you're being paid for your work. In Kenya, being a resident, you're not being paid, and I think it improves the person's morale to work hard and try to improve on their patients. Yeah, another thing that I love about here, the strength of this medical system is that if you say, let's do an MRI with contrast, wow, it's done. About 2 hours later, it's already been done. Then after that, you don't have to. Then it's interpreted within 1 hour, which is interesting because, like, if Michaela said she went to the medical ward like Nyayo, you find now that an MRI, if you order it now, unless it's an acute ill patient, it will take some time. Like if they can go for that MRI today, but there's a line there. Then interpretation, because radiologists are so few in Kenya, it takes a lot of. You might have the scans, but you're not a neurologist, so that the lesion is in this area, because some of it may not be clear to see. So you need a radiologist input. And yeah, I think sometimes like in Kenya you have a CT scan, but it takes 2 days to report that same CT scan, which makes a difference in terms of the management of the patient and trying to catch their pathologies early. An example being, this week I was in surgery. Here appendicitis is usually people are diagnosed with appendicitis right before it ruptures in the early stages. The surgery is laparoscopy. Yeah, in Kenya, majority come with busted appendix. So for that, you just have to do an open abdominal surgery together with training. So it's interesting. Yeah.
Okay, Aisha, I think you were going to answer. Let me answer you, and then we'll take some audience questions.
Okay, so for me, I like the turnaround time, as Kevin said, especially for the labs and the imaging. And like in Kenya, you have to follow it up, as Kipruto said, as in it will take you maybe 2 days. And for instance, maybe a patient has hyperkalemia, like the person can die before you get the lab results. And you really have to follow up with the CT people to follow up for your results. There's something for labs, and it's take a lot of time. So yes, for here, maybe like for the hyperkalemia, you can just bind on time, and yeah, things like those. Maybe Anthony and Wendy.
So for me, on top of what my colleagues have mentioned, there's the EMR. It's interesting to see that a patient's history from way back, you can even trace it all the way to childhood. It's been properly written, properly recorded. Everything is there, from their labs to their imaging to the next scheduled appointments to, I don't know, visits from other hospitals that are not Eskenazi. You can access that information, and it's really helpful in terms of management. Here in Kenya, it's hard to follow up inter-hospital information, patient information. So even within the hospital, sometimes records are not really within the file because we have physical copies of the files. So some pages might be worn out, especially those ones that are not from that week. If they're from way back, it will be hard to find all the information on that patient. So that's something that I think we should take back home, the EMR. Yeah.
I think my colleagues have mentioned most of what I found interesting. But basically, since we've had the same experiences, we were probably shocked by most of the things at the same time. To add on what they've mentioned, there's a time last week I had a chance to go with Dr. Jenny for her clinic, and I think that I noticed at that point that surprised me, but I also felt is very useful, is how the patients that would come to the clinic would have this screening tests for these common conditions, depending on the risk factor they have, or like their age and what you should check for. Maybe if I would check if the patient has had a colonoscopy in the recent past, when it is scheduled to be done again. Maybe if the female has had a pap smear and whatnot. I know such screening tests are done in Kenya also, but the level to which they're taken seriously here was very impressive, because you would find that even when the patient would come just for back pain, you would schedule for the patient, but then you inform the patient, but then you should come back in 2 months to have a what and what screened, which they don't have any symptoms. They probably don't have the disease, but early screening will enable for early diagnosis. And I think it is why it is possible for many conditions to be managed earlier here compared to Kenya. Because in Kenya, when the patient, as Kevin has mentioned, in Kenya, when the patient comes to the hospital, you might find the patient is already in stage 4 of cancer, or the patient, the condition has worsened to a point where it is difficult to help the patient. But I think when these facilities for early screening and early diagnosis, if they're well funded and when patients are educated on the importance of this test, I think it would help in the delivery of healthcare, basically. In Kenya, it may also be an issue of funding and whatnot, maybe, but I think such things should be encouraged more, even in Africa, and should be funded more. And maybe the patients should be assisted much more to acquire insurance so that they can cover for this test, even if they don't have money. So that some available conditions which would have been easier to manage at the beginning, so that they are managed early, basically. I found that it is impressive, because I found that like every patient in their records, they've had this screening tests which they found to be negative, but still, if they were positive, they would be treated for those conditions much earlier, and they'd still be okay.
Thank you, guys. Thank you for that.
Sorry, Dr. Jenny. There's something I've remembered. There's something I've remembered that I think is important to mention. The interaction between the attending, the resident, and the students has been incredible, in my opinion, because you find, as Kevin said, the consultants come in and stay from morning to evening, and they're available to the patients and the students at the same time. So you can interact with them on a one-on-one basis, and the environment is so relaxed. It's very conducive for learning and engaging and learning from each other, because it's a back and forth exchange between the attending, the resident, and the student. So it creates a very healthy environment for learning, which is something I think should go back home with us. Yeah, as future doctors.
Yeah, that's great. Thank you guys for those answers and for being with us tonight. We have just a few minutes left, so I want to give the opportunity for Dr. Bob Einterz to say hello and ask any questions. His name has helped support the fund, so I'd like to give him the opportunity to speak if he has a question.
Yeah, thanks so much, Jenny. Since I've moved around a little bit, I'll keep my camera off now. Yeah, it's been really a pleasure to listen to all of you, both Americans and Kenyans, and I appreciate your candor and your thoughtfulness.
Thank you guys, everybody, for joining us. Thank you, students, for your energy with talking to each other. I hope that everybody continues to keep asking them good questions. I also hope to see everybody at the AMPATH Global Gathering on October 8th in Indianapolis. So for those of you who are able, we'd love to have you in person. This event only happens once every few years, and I would love to give everyone a warm handshake. Yeah, thank you, Caitlin, for that link in the chat. So if you do, if people are interested in donating to the Einterz Fund, there is an opportunity to do that on the AMPATH website. And there is still a matching grant available, so that for every $2 you give, there will be an increase by $1. So thank you, everybody who was here tonight, and for all of your support of AMPATH in so many different ways.
Thank you.
Thank you for having us.
Thank you so much, everyone. Thanks, everyone, for coming. Nice to see you all.